welcome to the deep dive. You've given us some really interesting sources today, all focused on a disease I think many people probably haven't heard much about, maybe just the nickname rabbit fever.
That's right. Tularemia is caused by this bacterium Francisella tularensis. And yeah, rabbit fever makes it sound a bit old-timey, but these sources really hammer home that it's a serious infectious disease. It's still very much a concern, particularly for pets, and importantly for us humans, too.
Right. So our job today, as always, is to sift through this material you've provided and really pull out the need-to-know facts. We'll look at, what causes it, how it spreads, which sounds surprisingly easy, actually. What it looks like if, say, your cat or dog gets sick, how vets figure it out, what the treatment options are, and maybe most importantly, how we can all try and prevent it.
And it's worth pointing out the sources highlight its significance. It's officially a reportable disease here in the U.S. It's even been looked at, believe it or not, as a potential biological weapon. So that tells you something about its potential impact.
Wow. Okay. Definitely serious stuff. So let's start with the basics. This bug, Francisella tularensis. Tell us about it.
Okay, so picture a really small, kind of tricky bacterium. It's what we call a gram-negative coccobacillus, essentially a tiny rod shape. But what makes it particularly clever or dangerous is that it's a facultative intracellular parasite.
Okay, what does that mean in plain English?
It means it can actually survive and multiply inside our own cells or our pet cells.
Yeah.
It likes to hide out in organs like the liver. It basically sets up shop right inside the host.
Like a tiny Trojan horse. And the sources mentioned different versions, right? Different types.
Exactly. Two main ones to know. There's type A, F. tularensis, subspecies tularensis. That one's mostly found here in North America. It's really strongly linked with rabbits and hares, legomorphs we call them, and also ticks. And crucially, the sources say type A is generally the more virulent one.
More virulent causes worse disease.
Yeah, generally causes more severe illness. So type A, North America, rabbits, ticks, often more serious. Then you have type B. That's F. tularensis subspecies holarctica. This one's more widespread North America, but also Europe and Asia. It's often linked to rodents near water, like muskrats or beavers, and can even be in contaminated water itself. Generally, type B is considered less virulent than type A. Still causes disease, but maybe not quite as severe typically.
Got it. So who are the main carriers out there in the wild?
Well, the big reservoirs are those legomorphs, cottontail rabbits, jackrabbits, hares, and then various rodents. Think moles, squirrels, muskrats, beavers, even voles. If your pet tangles with any of these, that's a potential exposure route.
And is there a particular time of year when this is more of a problem?
Yeah, the sources point to peaks in the northern hemisphere. Late spring through summer seems to be the main one, say June to August. There's also a smaller bump mentioned around December, basically when animals and ticks are most active.
Makes sense. And where in the U.S. are we talking about? Is it everywhere?
It's surprisingly widespread, found in every state except Hawaii, actually, but it's most often reported in the central, north central, and western parts of the country. The sources list specific states like Missouri, Alaska, Oklahoma, South Dakota, Tennessee, Kansas. Quite a few.
Quite a range.
Definitely. Colorado, Illinois, Utah, Maine, Arkansas, Montana, Massachusetts, New Mexico. They even mention wildlife cases popping up near New York City. But it's interesting, it's apparently absent from places like the UK, Africa, South America, Australia. Although the sources do note there's been an increase in outbreaks in parts of Europe where it wasn't typically seen, which has kind of renewed interest globally.
Okay, so it's out there, carried by common wildlife, spread by ticks, more common certain times of year. How does it actually transmit? You mentioned the infectious dose is really low.
This is really key. The sources emphasize just how few bacteria it takes. Maybe only 10 to 50 of these tiny organisms to actually cause disease. That's incredibly low compared to many other bacteria.
10 to 50, that's nothing.
Exactly. For cats, they say it might just take a handful getting onto the skin, breathed in, or even just in the eye. It's startlingly infectious.
So how does that tiny amount usually get passed along?
Well, the most common route, especially here in the U.S., is vector-borne. So bites from infected ticks, they name the American dog tick, Rocky Mountain wood tick, Lone Star tick, or even deer flies. Tick prevention for pets is obviously huge here.
Right, number one.
Then there's direct contact or ingestion. This is a really big one for pets, especially cats. If they hunt, catch, even just mouth or play with an infected rabbit or rodent, bam, they can get it.
So that cute little gift your cat brings to the doorstep.
Could be a very unwelcome gift, yes. That's a major risk factor highlighted in the sources. Humans can get it this way too, like hunters handling infected animals without gloves.
Okay, what else?
Less common, but still possible. Drinking contaminated, untreated water, think stagnant ponds or streams in areas where it's present, or eating undercooked meat from an infected animal. And then there's inhalation, breathing in the bacteria if it gets aerosolized, maybe from dust stirred up by landscaping or mowing over an infected carcass. This route can lead to a really severe pneumonia form of the disease.
And can our pets give it directly to us? Like, if my cat gets sick.
It's less common than getting it from a tick or wildlife, but yes, it's possible. The sources mention bites or scratches from an infected pet, particularly cats, as a way humans can get it. Even contact with their saliva.
Wow.
And they also mention that dogs, even if they don't seem very sick themselves, if they've mouthed an infected animal, they could potentially carry the bacteria on their fur or in their mouth and sort of act as a living contaminated object, a fomite, that could expose people.
Okay, so once the bacteria gets in, what happens? How does the disease progress?
It kind of depends on how it entered. If it got in through the skin, maybe a small cut or tick bite, it often starts multiplying right there, sometimes causing an ulcer. Then it tends to spread through the lymph system and into the bloodstream.
And if they eat it?
If it's ingested, it might first cause issues in the lymph nodes around the throat or in the abdomen, causing swelling there, before potentially spreading more widely. Typically, you start seeing signs of acute illness within, say, 2 to 7 days after exposure.
Okay, so that's the background. Now, what does it actually look like if a pet gets sick?
Yeah,
The sources say it can be hard to recognize.
that's a huge challenge, yeah. The clinical signs are often really non-specific, vague, easily mistaken for other things, and that incubation period is usually somewhere between 1 and 10 days. Plus, there's often a big difference between cats and dogs.
Right. Tell us about that difference. How does it show up in cats versus dogs?
Cats, generally speaking, are much more susceptible to actually getting clinically sick. It can range from them showing almost no signs, maybe being a little off, to getting severely ill extremely quickly. Sometimes it's fatal.
Oh, wow.
Yeah, acute signs in cats often include a really high fever, we're talking, like 104, 106 degrees Fahrenheit, so 40, 41 Celsius. They'll be really lethargic, just wiped out and completely off their food.
Is there anything more specific vets look for in cats?
Yes, one of the sort of hallmark signs, especially in cats, is enlarged lymph nodes. They're often quite painful, particularly the ones around the head and neck. And these nodes can sometimes abscess, fill with pus, and even rupture and drain.
Oof. Sounds nasty.
It is. You might also see sores or ulcers inside the mouth, maybe on the tongue. They can also get an enlarged liver and spleen, which sometimes leads to jaundice, that yellowish tinge to the skin or eyes.
Any other signs in cats?
Sometimes vomiting, diarrhea, maybe coughing or nasal discharge if it hits the lungs. The sources really stress that very sick cats can deteriorate incredibly fast and unfortunately often don't make it.
That sounds really scary for cat owners. What about dogs? You said they handle it better.
Generally, yes. Dogs seem much less susceptible to the severe forms of the disease. Often their infections are milder. Sometimes they might even fight it off without getting seriously ill at all, sort of self-limiting.
So what would you see in a dog then?
Maybe just a mild fever. They might be a bit sluggish, not as hungry as usual, maybe some slightly swollen lymph nodes. But those big draining abscesses you see in cats are much less common in dogs. Severe stuff like jaundice or organ failure is pretty rare, especially in healthy adult dogs.
But you mentioned earlier, even if they're not very sick, dogs can still pose a risk to humans.
Exactly. A dog might just have mild signs, or maybe none you'd notice, but if they've been, say, chewing on an infected rabbit, they could still have the bacteria in their mouth or on their coat and potentially pass it to a person through close contact, a lick, or handling.
So which specific pets are at the highest risk of getting this in the first place?
Well, the sources really point to cats that go outdoors, especially hunters, in areas where tularemia exists. Their instinct to hunt rodents and rabbits puts them right in the line of fire. But really, any pet in an endemic area that has contact with wildlife or gets bitten by ticks is at increased risk.
Okay, so let's say a vet sees a pet, maybe a cat, with a high fever, really lethargic, swollen lymph nodes under the jaw. Given how serious this is, and the risk to people handling the pet, how do they figure out if it actually is tularemia?
This is super critical. The sources emphasize that vets need to have a high index of suspicion, especially, like you said, if they're in an area where the disease occurs and the pet has a history suggesting exposure, maybe ticks, maybe known contact with wildlife.
Right.
And if tularemia is on their list of possibilities, they must tell the diagnostic lab. This isn't a run-of-the-mill sample. Francisella tularensis is a biosafety level 3 pathogen. It requires special handling procedures to protect lab workers.
Oh, BSL-3. Okay. So high suspicion, warn the lab. What tests might give them some clues initially?
Well, routine blood work, like a CBC complete blood count, can be suggestive, but not specific. Often, early on, you might see a really low white blood cell count called panleukopenia. Then later, it can swing the other way to a very high white count, with signs the immune system is really fighting hard what we call a left shift and toxic neutrophils. Platelets might be low, too.
And what about the chemistry panel? Looking at organ function.
That might show things like elevated bilirubin, which indicates liver stress and explains the jaundice if it's present. You might see electrolyte issues like low sodium, maybe low blood sugar. Liver enzymes like ALT could be high. But again, these just tell the vet the pet is very sick, not why.
So you need specific tests to confirm tularemia. What are those?
The absolute definitive test, the gold standard, is bacterial culture. Trying to actually grow Francisella tularensis from a sample blood, maybe fluid from a lymph node aspirate or tissue.
But you said it needs special handling.
Exactly. Big but. This bacterium is finicky. It won't grow on the standard culture media most vet clinics use. It needs special enriched media containing things like cysteine. And because it's so infectious to people, culturing must be done in a specialized reference laboratory with those BSL-3 safety precautions. The sources are very clear. Extreme care is needed when collecting and handling these samples.
Okay, so culture is definitive, but difficult and requires a special lab. Are there faster, maybe safer options?
Yes, thankfully. And these are often preferred because of the safety concerns and speed. PCR assays, polymerase chain reaction, are really valuable. These tests detect the bacterium-specific DNA.
Right, the genetic fingerprint.
Precisely.
Okay.
You can run PCR on blood or tissue samples. It's highly sensitive, very specific, relatively fast, and avoids the risk of growing the live bacteria. So PCR is often a go-to test.
What about antibody tests, serology?
Serology is another tool. It looks for antibodies the pet's immune system produces against the bacteria. A single high antibody level, a high titer, suggests exposure at some point. But to confirm an active current infection with serology, you ideally need paired samples.
Paired samples, meaning?
You take one blood sample early in the illness and another one maybe 2 to 3 weeks later. If you see a significant rise in the antibody level, typically a 4-fold increase between those two samples, that's strong evidence of an active infection.
Makes sense. Is there a downside to antibody testing?
The main limitation is timing. It takes time for the body to build up detectable antibodies, often 2 to 4 weeks, so a test done very early in the disease might be negative, even if the animal actually has tularemia. Also, some very sick animals might not mount a strong antibody response, or the tests might need to be sent out to a reference lab anyway.
Okay. Any other tests mentioned?
The sources briefly mentioned things like looking at smears directly under a microscope, but the bacteria can be hard to see. There's also direct fluorescent antibody testing, which uses special antibodies that glow to detect the bacteria in samples that can be rapid, and other molecular methods beyond standard PCR.
And I imagine imaging like X-rays or ultrasound might play a role too.
Definitely. Chest x-rays would be important if the pet is coughing or having trouble breathing to look for pneumonia. An abdominal ultrasound can help assess the liver, spleen, and those internal lymph nodes, looking for enlargement or other changes.
It sounds like diagnosis can be quite a puzzle. What other diseases might a vet be thinking about that could look similar?
Yeah, the differential diagnosis list can be long because the signs are vague. They need to consider other things that cause fever, lethargy, swollen lymph nodes, maybe mouth sores, or just rapid decline. Things like pseudotuberculosis, which often causes more gut signs like vomiting or diarrhea, or tick-borne diseases like babesiosis.
Especially in dogs, I guess.
Right. And in cats, they'd also think about things like certain viral infections, calicivirus, maybe feline immunodeficiency virus, FIV, or even toxoplasmosis. The vet has to put all the clues together. History, signs, location, initial tests.
And if they do get tissue samples, maybe from a biopsy or, sadly, after death, Are there characteristic signs of tularemia they'd see?
Yes, the sources describe some typical pathological findings. You might see these multifocal white spots or ulcers, especially in the mouth tissues. Those swollen, maybe abscessed lymph nodes, particularly cervical, retropharyngeal, submandibular, basically around the head and neck. There might be lesions throughout the intestines, swollen abdominal lymph nodes, and that enlarged liver and spleen, maybe with jaundice.
Okay, so it's a complex diagnostic process. Let's say tularemia is confirmed, or at least highly suspected.
hmm
What's the treatment plan?
The sources sounded pretty urgent about starting treatment. Incredibly urgent. They've really stressed the absolute critical importance of early diagnosis and starting aggressive antibiotic therapy immediately. They use strong language saying treatment is often unsuccessful if delayed, and the outlook is poor if those abdominal lymph nodes are involved, suggesting it spread widely.
So don't wait. What does treatment involve besides the antibiotics?
Often, especially for sicker animals, it means hospitalization for intensive supportive care. Things like 5e fluids to combat dehydration and shock, good nursing care, pain management, maybe NSAIDs or even opioids medications to control fever, nutritional support since they're usually not eating, and potentially wound care if there are draining abscesses.
And given the zoonotic risk, I assume special precautions are needed during treatment too.
Absolutely essential. Strict infection control protocols are a must for anyone handling the animal: gloves, gowns, maybe masks and eye protection, proper disinfection because of that incredibly low infectious dose for humans. Isolate the animal if possible.
Okay, what about the core treatment, the antibiotics? Which ones are effective?
The sources consistently point to aminoglycosides as the top choice. Drugs like streptomycin, or more commonly used now, gentamicin. They're called the drugs of choice and highly effective. They give dose examples, usually given by injection once or sometimes twice a day for maybe 7 to 14 days. A key thing with these is monitoring kidney function, as they can be tough on the kidneys.
Are there good alternatives if aminoglycosides aren't suitable for some reason?
Yes. Tetracyclines, especially doxycycline, are listed as an effective alternative. This might be used for milder cases or perhaps as an oral medication to continue at home after starting with injections. It's usually given by mouth once or twice a day.
And there was something about treatment duration.
Yes, this is important. With doxycycline and also the other alternatives, while a typical antibiotic course might be 2-3 weeks, the sources specifically mention needing potentially much longer treatment for tularemia, sometimes 3 to 8 weeks, to really make sure the infection is cleared and doesn't relapse.
3 to 8 weeks, that's a long time on antibiotics.
It is, but it reflects how difficult this intracellular bacterium can be to eradicate completely. Fluoroquinolones are another effective class-mentioned drugs like enrofloxacin or marbofloxacin, again, potentially for that longer 3 to 8 week duration. Ciprofloxacin is also noted as showing promise.
Any others?
Chloramphenicol is mentioned as effective, but rarely used nowadays because of the potential for serious side effects in pets and people, like bone marrow problems. Generally, vets will start treatment based on high suspicion, often with one of the preferred drugs, while waiting for definitive test results.
So aggressive, prompt, potentially long-term antibiotics plus intensive supportive care. What's the bottom line on prognosis? How likely is the pet to pull through?
This really brings back that difference between cats and dogs. For cats, unfortunately, even with prompt and aggressive treatment, the prognosis is often described as guarded to poor, particularly if they present already severely ill. The sources indicate high mortality rates are definitely possible in cats.
That's really tough news for cat owners.
It is. It highlights how serious this can be in felines. For dogs, the outlook is generally much brighter. The prognosis is usually considered good, their infections tend to be milder, and they often respond well to the appropriate antibiotics.
But for both, catching it early is key.
Absolutely critical. For any species, the earlier you intervene, the better the chance of a successful outcome. Early treatment significantly improves survival chances.
Okay, and that leads us perfectly into what the sources call the really crucial aspect, the risk to humans. This isn't just a pet disease. It's highly zoonotic.
Yes, absolutely. This is probably the single most important message for everyone listening. Tularemia is a highly zoonotic disease. It jumps readily from animals to people. It poses a significant public health risk. Just remembering it's been considered a potential bioweapon agent underscores why we need to take transmission seriously.
How do people most typically get infected?
The most common way in the U.S., according to the sources, is still bites from infected ticks or deer flies. But, and this is vital for pet owners, direct contact with infected animals or their tissues is a major route too. Handling sick or dead wildlife, especially rabbits and rodents, without proper protection like gloves.
And specifically from our pets.
Yes, the sources are very clear about this risk. Bites or scratches from an infected pet, particularly cats, can transmit the bacteria to humans. Even contact with a sick pet's saliva is a potential route.
So care is needed handling a sick pet suspected of this.
Definitely. Other routes for humans include drinking contaminated water, eating undercooked infected meat, and that inhalation route we talked about, breathing in aerosolized bacteria, maybe from contaminated environments, which can cause the most severe pneumonic form.
What would tularemia look like in a person? Briefly.
It varies a lot depending on how you got exposed. Common symptoms often include sudden fever, chills, headache, muscle aches, and just profound fatigue. Frequently, you'll see a skin lesion, like an ulcer or blister, where the bacteria entered, along with swollen, painful lymph nodes in that region. But there are other forms affecting the eyes, the throat, a general typhoidal form without a clear entry point, and that really serious pneumonic form affecting the lungs.
And just to reiterate, if a vet diagnoses this in an animal, you go portable.
Yes, absolutely. Tularemia in animals is a reportable disease in the U.S. Vets are required to notify local and state public health authorities. It's part of tracking and preventing wider outbreaks.
Okay, so prevention is obviously vital, both for our pet's sake and for our own. What are the key prevention strategies recommended in these sources?
They lay out several critical steps. First and foremost, arthropod control. That means diligent, year-round use of effective flea and tick preventatives on your pets. Use products recommended by your vet, especially if you live in or travel to areas where tularemia is known to occur.
It seems basic, but clearly essential here.
Fundamental. Second, and this is huge for preventing pets from getting infected in the first place, limit their exposure to wildlife. For cats, the single most effective thing you can do is keep them indoors, period. It stops them hunting those infected rabbits and rodents.
Makes sense. What about dogs?
For dogs, keep them on a leash when walking or under close supervision in yards, especially in rural or wooded areas. Prevent them from chasing, catching, or scavenging wildlife carcasses. And for people, never handle sick or dead wild animals with your bare hands. If you must move a carcass, wear sturdy gloves and dispose of it properly, then wash your hands thoroughly.
Water safety was also mentioned.
Right. Don't let your pets drink from untreated, potentially contaminated water sources like stagnant ponds, streams, or lakes, especially in endemic areas. Provide fresh, clean water.
And just good general hygiene.
Always important. Wash your hands thoroughly with soap and water after handling your pets, especially if they seem sick or have been outdoors. The sources also advise against letting pets lick your face, particularly if the pet is unwell or could have been exposed.
And within the vet clinic itself.
Vets and their staff need to use appropriate personal protective equipment, PPE. Gloves, gowns, masks, eye protection when handling any animal suspected of having tularemia. Ideally, the animal should be isolated to prevent potential spread within the hospital environment.
This has been a really thorough look at a disease that, like I said, many might not realize is still such a concern.
It really is. So just to quickly recap the key points. Tularemia, rabbit fever, caused by Francisella tularensis, spread mainly by ticks and direct contact with infected wildlife, especially rabbits and rodents.
Can be very severe and even fatal in cats, though often milder in dogs. Diagnosis needs specific lab tests, careful handling, and it's reportable.
Exactly. And treatment needs to be prompt, aggressive, with specific antibiotics, sometimes for extended periods, but success isn't guaranteed, especially if caught late.
And crucially, it's highly zoonotic, a real risk to humans from various sources, including infected pets, especially cats via bites or scratches. Prevention through tick control and limiting wildlife exposure is absolutely key.
And veterinary teams are really on the front lines with this one, recognizing potential cases, knowing how to handle them safely, treating the animal, and educating owners about the risks and prevention. It's a vital role.
And here's a final thought to leave you with, something interesting from the sources.
Yeah.
They mentioned that seeing a cluster of pneumonia cases in pets, like dogs or cats, could potentially serve as an early warning, like a sentinel event, for human tularemia risk in that area. What does that really tell us about the deep connection between animal health and human health, the whole One Health concept? Could paying closer attention to seemingly isolated issues in our pets actually be a critical early warning system for bigger public health threats? Something definitely worth thinking about.